Welcome friends to this new video. It's part 21 of the Solved Pharmacy MCQs video series. So big welcome to all the friends for joining me here. Thanks. And so we will be going towards our new set of MCQs. We will try to discuss them and also try to solve them. So be with me. Now our first MCQ, NAPLEX test is used for, it is actually a test for the detection of diphtheria, dysentery, scarlet fever, syphilis or typhoid. So actually NAPLEX test is used for diphtheria. So A is the correct option here. Now our second MCQ, KAAD test is used for diagnosis of diphtheria, dysentery, scarlet fever, syphilis or typhoid. Actually it is a syphilis. KAAD test is used for the diagnosis of syphilis. Now moving on to the third MCQ, Vidal test is used for, again options are there, and actually we know that Vidal test is used for the diagnosis of typhoid. Moving on to the fourth MCQ, Dick test is used for diphtheria, dysentery, scarlet fever, syphilis and typhoid. Actually Dick test is used for scarlet fever. Now our fifth MCQ, it is actually a calculation MCQ, and one has to remember this by heart. The MCQ asks us 1 kilogram or 1 kg is equal to how many pounds. So in Britain mostly pound is used as the unit for weight. So 1 kg is actually equal to 2.2 pounds. So C is the right answer here. So our sixth MCQ, if the adult dosed for a medicine is 400 milligram, then what will be the dose for a 5-year-old child? So these dose quantities are given as options, and the correct option is to be find out. So actually this is a calculation MCQ, and it can be solved by using the Young's formula, which is actually a child dose calculation formula. So that is actually equal to age of the child in years divided by age of the child in years plus 12, then it has to be multiplied by the adult dose. So if we use this formula, then it will be like this, that 5 divided by 5 plus 12 multiplied by 400 milligram, and this will give us 117 milligram as the answer. So this MCQ can be solved very easily by using the Young's formula. And the same formula is discussed here again in this MCQ. They ask about the same formula here. So moving on to this MCQ, if you know about the adult dose and the age of the pediatric patient, how are you going to calculate the dose for the little patient? Then these options are there: divide adult dose by child dose and so on. So actually this is again the same subject MCQ like the previous MCQ. In this it is asked about the Young's formula. So if we know that formula, we can see it here. It is actually this formula: child's age divided by child's age plus 12 multiplied by adult dose. So this is the Young's formula for calculating the child dose. Moving on to the 8th MCQ. Cingulate gyrus is located between which structures of the brain? Cingulate gyrus, it is actually a structure that is located in the brain, and here the MCQ asks us that between which structures this cingulate gyrus lies. So options are given: frontal lobe and corpus callosum and thalamus, pons and temporal lobe, cerebellum and ventricle, cerebrum and cerebellum. So actually it is the frontal lobe and corpus callosum between which cingulate gyrus is located. Now the 9th MCQ. All of the following statements are true about aspirin except one. So it is an irreversible non-selective COX inhibitor. This is true about aspirin. It can cause gastric irritation and bleeding. Of course, it is also true. Can cause acid-base imbalance. It is also true because aspirin itself is an acid, acetyl salicylic acid. Of course, a weak acid, but still it's an acid, and it can cause acid-base imbalance. It is contraindicated in asthma patient. This is also true, and it is safe in children. And this one is not true. It is not safe in children. Aspirin should not be given to children, for they can cause an adverse reaction, and we will study that reaction in the next MCQ. One of the following medications causes Reye's syndrome in children and thus not given to them. Actually, Reye's syndrome is a rare syndrome in which there is swelling in the brain and liver is caused. So one of the below given options, there is a medicine that can cause this Reye's syndrome, or it can precipitate that syndrome. So options are paracetamol, ketoprofen, aspirin, ibuprofen and metoclopramide. So actually Reye's syndrome is caused by aspirin in children, and thus this medicine, that is aspirin, is not safe in children, as is asked in the previous MCQ. Aspirin is not safe in children. So I think this is enough for now, friends. Thanks for watching, and I hope you must have learned something or other from this video, and if you have, then please support me by liking this video and sharing this with your friends, and also subscribing to my channel. So thank you very much for your time.